5 NCLEX questions of the day. Question number 1. Which diagnostic test is most specific for a client who is suspected to have rheumatoid arthritis? A. Anti-citrullonated protein antibody, ACPA. B. Rheumatoid factor RF. C. Erythrocyte sedimentation rate, ESR. D. C-reactive protein, CRP. Although all these tests can be ordered to diagnose RA, ACPA is the most specific for RA. Rheumatoid factor is also specific, but it is also found in other autoimmune diseases like lupus. ESR and CRP indicate generalized inflammation and are not specific. They are mostly used to monitor treatment effectiveness. Question number 2. A client newly diagnosed with osteoarthritis reports to have a painless popping sensation when bending the knees. What should the nurse do? A. Report finding to the provider. B. Encourage the client to use knee braces to reduce excessive movement. C. Reassure the client that this is an expected finding. D. Encourage the client to rest in bed more often. As we recall from my osteoarthritis video, crepitus, also described as a crunching sound, popping sensation, is a common finding in osteoarthritis. It is due to the damaged joint surfaces and cartilages rubbing together. It usually does not cause concern unless it's associated with pain or discomfort. So answer choice C is correct. There is no need to report finding as this is an expected finding. Question number 3. The nurse takes care of a client with rheumatoid arthritis. Which of the following signs and symptoms would the nurse expect to find? Select all that apply. A. Anorexia. B. Pain on the joints from wear and tear. C. Swan neck deformity. D. Boutonniere deformity. E. Crepitus or joint popping with movement. In my RA video, we went over the signs and symptoms for RA, which include swollen, stiff, and painful joints, and that pain is usually bilateral and symmetrical. Pain increases with rest and relieves with movement in RA, which is the opposite in osteoarthritis. Prolonged morning joint stiffness that lasts for more than 1 hour is a classic sign of RA. And when the small joints in the hands are affected, deformity can occur and result in swan neck and boutonniere deformity. Since RA is a systemic disease, generalized symptoms like fatigue, anorexia, and weight loss can occur. With that in mind, let's go back to the answer choices. Choices A, C, and D match what we just mentioned. Choice B says pain on the joint, which is correct, but as we remember, RA is an autoimmune disorder. It is not caused by wear and tear, which is the primary cause for osteoarthritis. So B is incorrect. Choice E mentions crepitus, which is a common sign of osteoarthritis, but not RA. Question number 4. A client with rheumatoid arthritis is inquiring about pain management. How should the nurse respond? Select all that apply. A. Perform range of motion exercises. B. Encourage bed rest. C. Elevate knees during sleep. D. Use a warm towel on the affected joints. E. Take NSAIDs as prescribed. As mentioned earlier, pain in RA increases with rest and relieves with movement because movement helps to keep joints flexible and prevent stiffness. So that makes choice A correct and choice B incorrect. Choice C says elevate knees during sleep, which is not recommended because it could promote contracture. Choice D and E are both correct. Other pain interventions for RA include use of cold therapy, low-impact exercises, and use of joint-protecting devices during acute phases. Question number 5. The nurse provides education to a client prescribed with disease-modifying anti-rheumatic drugs. Which statement made by the client indicates successful teaching? A. I am glad I can continue to enjoy sushi. B. I should wear sunscreen and a hat when I do gardening. C. I will engage in more low-impact exercises such as walking in the mall. D. I will schedule an appointment to screen for tuberculosis and hepatitis B and C. As we recall from my video, disease-modifying anti-rheumatic drugs, or DMARD, are the primary treatment for rheumatoid arthritis. The most concerning side effect of this drug category is that it suppresses the immune system and puts clients at a high risk of getting infection. So, it is very important to educate clients on measures to prevent infection, which include avoiding places with large crowds, avoiding contact with sick individuals. Wear a mask when going to public places. Food should be thoroughly cooked. Fresh fruits should be washed thoroughly. No gardening or handling cat litter due to risk for fungal infection and toxoplasmosis. So answer choices A, B, and C are all incorrect. Although walking is a fantastic exercise for RA, clients on DMARD should avoid crowded places such as malls. Answer choice D is correct because DMARD can reactivate latent infections such as TB and hepatitis, and clients need to be on prophylaxis to prevent reactivation before starting DMARD. Thank you for reviewing the questions with me. Please like, comment, and subscribe if you want to see more NCLEX review videos. Thank you.